Hi everyone. Just a quick briefing about the vaccination program implemented to all the education sector in Gauteng Department of Education. Edward Mosuwe has sent out a circular on how this rollout will happen, and it's important information to share with you. Recently, our President Sasl, announced that he's procured a lot of vaccines for the education sector, which is a relief, and all our MECs in the provinces and the Minister were quite excited so that we as the education sector can be vaccinated. Let me explain to you how it will happen. The vaccine is there to normalize schooling again, because the whole time we've been interrupted with isolation, COVID cases, etc. And to prevent that from going like this ongoing, we would like to get everyone vaccinated. The Department of Health in Gauteng and the Department of Education in Gauteng work together to implement with the principals and the district officials the vaccinations. The dates are important. It starts on the 23rd of June until the 8th of July. All of the educators and staff must be vaccinated within these few days. People who are eligible to receive the vaccine is all the staff appointed by the Department of Education. Each one of you have a personal number on your salary slip. The Department of Education would pay your salary via the personal number. You're automatically registered for the vaccines. The schools then provide all the HTB staff members a list to the department. They're also automatically registered on the EVDS system, which is the vaccination data system, where all people must be registered to get a vaccination. So the Department of Education makes sure everyone is registered. If a staff member is appointed after the 1st of April this year, unfortunately, you're not on the system yet. The Department of Education will announce soon if those staff members can be vaccinated. All of the information, your personal number, your STB staff number, everything is populated. So you don't have to worry to go and register yourself. The department has automatically registered you. When you arrive at the destination for your vaccine, you must provide your ID, and if you have a medical aid, your medical aid card with. Then you must also provide your phone number at the destination for your vaccine. When you arrive at the destination and your name does not appear there, do not worry. The staff there will guide you on how to register you for a later stage of vaccine. For all the staff members that are not registered this time, will be registered soon. The district and the provincial Department of Health and Education worked together to schedule your vaccine closest to your school. They will map it to the closest destination where you should go for your vaccine. Remember, when you go for your vaccine, you cannot go close to your home. You will leave from the school. The district will allocate you to a destination close to your school. They will inform the principals where you should go. You must give all your staff members a letter when you arrive at the destination, because there might be load shedding or you will be disappointed that the system is down or something, all your information will be on this letter that you work for the SGB or for Sasl or for the department. Everything will be on the letter. You will provide the letter to get the vaccine. Firstly, if you cannot get the vaccine and you have contracted the COVID virus in the last 30 days, you will not be able to get the vaccine. If you've received the vaccine previously, like the Pfizer or Johnson & Johnson, you're also not eligible to get the vaccine. If you received the flu vaccine in the last 14 days, you cannot get the COVID vaccine. The vaccine will include all staff members that transport learners, that provide food, staff, office staff, assistants, educators, and the security, maintenance staff, people who are registered working in the school. Transport from your school to the vaccination site. It is expected that the staff members must arrange their own transport. But if you are really stuck and you do not have a car, etc., the school will be expected to help you with transport. Uber has offered 100,000 free rides nationwide for staff members. How that will unfold, we will inform you how you can opt for the Uber free ride. You can either transport yourself or follow the school's transport or go via Uber to the vaccination site. Once you've got your vaccine, you have to wait 15 minutes to show that there's no side effects and you feel good. Then you can go back to school and continue your work. If you receive the vaccine and you have a side effect and you do not feel well, sick, or you have a headache or whatever, you must inform the local nurse there. They will tell you what to progress, how you should go home, etc. They will guide you exactly what to do. When you get the vaccine, it is your choice. You are not forced to opt for the vaccine. But the Department of Education and Health are encouraging you to think about getting the vaccine to help you prevent serious COVID infection. It will not prevent you from getting COVID, but it will prevent you from getting a serious COVID infection, especially for staff who have core morbidities like heart problems, diabetes, epilepsy, etc., asthma, and so forth. We encourage you to get the vaccine. But it's up to you. It's your choice. Remember, if you have a comorbidity and you want to apply for working at home and you've not received the vaccine, unfortunately, you cannot apply to work from home then. From tomorrow onwards, the district and the department will inform the schools and the principals how to manage the program of COVID vaccines. And we will also inform you where it will be, closest to your school, where you should be going. And they will also inform how many staff can go at once. Not the whole school will go. On a specific day, a limited number of staff members will go, and the following day and the following day. This means that staff that is still at school are here, so teaching and learning can happen. The principals will manage the staff numbers and names that will go for the vaccine. The staff currently in isolation at home that have self-quarantined because they came in close contact with a COVID case, the Department of Health will inform us how we will manage those staff members to enable them to get the vaccine. So, staff, there's a busy time ahead for us. Maybe you'll go in one day, stand in a queue, get your vaccine. But remember, when you arrive at the vaccination site, it is important to follow the non-pharmaceutical rules. Wear a mask, sanitize, social distance. But once you get your vaccine, do not think you don't need to wear those masks and not follow those rules. You still have to continue following those rules. I hope this will be a successful drop everything and get vaccinated campaign. Thank you.